Hello, my name is Betty Chingy, a student at the Catholic University Santiago de Guayaquil. My topic is Renin, Angiotensin, Aldosterone System Blockers at the risk of Covid-19. Definitions. Studies in animals have shown that angiotensin converts enzyme 2, ACE2, a membrane-bound aminopeptide that is abundantly spread in the lungs. The heart of other tissues is used by coronavirus as a functional receptor for their entrance into the cells. Next, we will see a video.
Renin Angiotensin Aldosterone System. The renin-angiotensin-aldosterone system is a classic endocrine system that helps to regulate long-term blood pressure and extracellular volume in the body. The system begins with the release of angiotensinogen into circulation by the liver. This may be in response to low blood pressure and adverse changes in sodium concentrations. An enzyme, renin, is secreted, which cleaves angiotensinogen to form the inactive decapeptide angiotensin 1. Further transformation of angiotensin is carried out by angiotensin-converting enzyme, or ACE. This is predominantly found in the pulmonary circulation. However, ACE is also produced in the vascular endothelium of many tissues, including the kidney, adrenal gland, brain, and heart. The angiotensin-converting enzyme converts the inactive precursor angiotensin 1 into the vasoactive peptide angiotensin 2. In addition, alternative pathways exist that do not rely on either renin or ACE. In non-renin pathways, enzymes like tonin and cathepsin D release angiotensin 1 from angiotensinogen and tissue plasminogen activator, or TPA, and can make angiotensin 2 directly from angiotensinogen. This bypasses the midway production of angiotensin 1. Enzymes like chymase can form angiotensin 2 from angiotensin 1 via an ACE-independent pathway. Angiotensin-converting enzyme also degrades bradykinin, which is required for synthesis of a major vasodilator, nitric oxide. Angiotensin 2 binds AT1 receptors expressed on the surface of vascular endothelium and impairs nitric oxide synthesis as well. Reduced bioavailability of nitric oxide combined with the stimulation of AT1 receptors on smooth muscle cells causes vasoconstriction. In addition to a vasoconstriction effect, stimulation of AT1 receptor causes the adrenal glands to release the hormone aldosterone, resulting in sodium retention. Combined with vasoconstriction, this increases blood pressure. In the final stages of RAS, the kidney reduces the production of renin. Most of the known actions of angiotensin 2 are mediated through the AT1 receptors, which can be found in the kidney, heart, vascular smooth muscle cells, brain, adrenal glands, platelets, adipocytes, and the placenta. Angiotensin 2 type 2 receptors can be found in low levels mainly in the uterus, adrenal, central nervous system, heart, and kidney. AT2 receptors appear to counteract the effects of AT1 receptor stimulation. Another angiotensin 2 type receptor is the AT4 receptor. Its stimulation may increase synthesis of the natural inhibitor of TPA called PI1, thereby reducing effective fibrinolysis. Stimulation of AT4 receptor appears also to promote cell growth and proliferation.
Application in nursing. Angiotensin receptor blockers, ARBs, and ACE inhibitor are considered first-line drugs for the treatment of hypertension, heart failure, chronic kidney disease, and postmyocardial disease. and also increase the expression of ACE2 inhibitors were prescribed more frequently in patients than in control in the investigation. Pros. The hypothesis has been developed that the use of blocker can modify the susceptibility to infection with severe acute respiratory syndrome, coronavirus, to SARS-CoV-2 in humans and developed. The RAS blocker increase the risk of several clinical manifestations of COVID-19. There might have been preferred the dispensation of RAS blockers to patients with better clinical profiles and a lower perceived likelihood of the development of severe COVID-19. Next, we will see a video.
So what about ACE inhibitors and angiotensin receptor blockers? I have hypertension. I take an ACE inhibitor. I'm going to keep taking it. I think you should too. I think this is a terrible time to be adjusting your medications if you're doing well and your blood pressure is well controlled. These medications prevent kidney disease progression. They reduce your risk of heart disease. So very important to continue taking those. If you do, God forbid, become infected, and I don't wish that on you, but if that happens, that's something that the care team may decide to address. That's something, a decision to stop a drug now is really up to your clinician and no one else, and certainly you as a patient should not stop your medicine because of some fear that probably we don't understand yet and needs to be studied more.
Issue applied in Ecuador. In Ecuador, too many cases of COVID-19 have been controlled with different treatments, now exclusively with the use of ACE inhibitors and ARBs. In conclusion, in this large population-based study, the use of ACE inhibitor and ARBs was more frequent among patients with COVID-19 than among control because of their higher prevalence of cardiovascular disease. However, there was no evidence that ACE inhibitors or ARBs affected the risk of COVID-19. Thank you very much for